Well, thank you, everyone. I know that this is kind of coming to the end of the conference, and hopefully, you've all learned a lot. For this session, I'm just going to let you know that some of the things that I'm going to be explaining and teaching might seem a little scary, but I think awareness around this topic is really important so that you're prepared and that you can take some of that worry and really transfer it into an action plan. So my name is Lydia. I am a pharmacist of over 30 years. I owned and operated. I was on the front lines most of my career, and as well as in management. I worked with addiction centers, shelters, long-term care, assisted living facilities, group homes. So I've seen a whole gamut of different areas where healthcare and pharmacy and medications are a pivotal part of therapy and how that happens. What I also did with my training is I became a certified patient safety officer. So I really looked at things from the lens of how do we make things safe. And so that's kind of where I realized a lot of the safety issues that we're facing can really become enhanced for a healthcare professional and for the patient when the patients are actively involved. So when the families are actively involved, if you're advocating for someone. So that's kind of what we want to go through today. So we want to just look at how do we look and navigate some of the common health and safety red flags in the healthcare setting. How do I equip you with strategies to prevent and respond to certain healthcare situations where you feel you're not necessarily being heard or listened to? What does that communication look like at home between yourselves, other caregivers, somebody that needs, you need assistance with, and also how you yourselves can take some time to actually pause and give yourselves as caregivers that much needed objective so that you can like the objective of how you can cope and how you can take care of yourselves while caregiving and while navigating some of these systems in the healthcare system, because they're not easy, of course, as we know. So really the importance of navigating healthcare. I want to just really focus on some of the issues that we're facing in healthcare today that could and would not have been necessarily present maybe even 5 years ago. Unfortunately, with COVID, there has been so many changes in the healthcare system because of the time constraints, the amount of money that was spent at that time, and also there was just so much happening in terms of, what do we believe? What don't we believe? And so there's a lot more questions around healthcare and the trust of the healthcare system. So we want to address some of those things. When we look at the reasons why healthcare is risky and how it's become more risky, we have to imagine that we now have situations where COVID did push almost 25% of healthcare staff into retirement early or changing positions. A lot of the nurses changed their positions. They just walked out, they found other things to do. So there is and there has been a lot of shifts in our healthcare system, which means now we have overwork and fatigue. And we did have this before, but it's exemplified when you have less people as well. So now you're working more shifts, you're now tired, you're doing more with less people. And so you have to remember that when you're a patient, think about the healthcare professional as being somebody who's potentially been working a 12, 14 overnight, 5 nights in a row shift. They're not all firing with all of the capacity that they would have had if they would have had a proper night's sleep or if they don't have all the pressure of things they need to do. So, of course, if you think of yourself in a situation like that with anything that you're doing, you're likely to make more errors. So, we're setting ourselves up in a lot of ways in the healthcare system for failures to begin with, just in the way that we sometimes schedule our staff. And then you have to think about the different divisions and all the communication breakdown that can occur between, let's say, lab and, pharmacy, or pharmacy and nursing, and how something needs to be mixed, or the physician and pharmacy. So we see these challenges as well with communication breakdown. So I always say when you're going from one sector of the healthcare system to another, you want to be the string that is attached to all of it. Your information needs to be very crystal clear in speaking to all those healthcare professionals, because you're the main goal, and your family, the one that you're caregiving for, that's the person that you're advocating for, and you have all the information straight across. So you want to make sure that you keep those records so that if somebody is asking you a question, you have the answer. And I have seen something as simple as an allergy to penicillin end up causing the person to be in ICU because of the bad anaphylactic reaction, and that being missed through that transition of care. So something as simple as an allergy, which is deadly if you give the wrong medication, can have those types of consequences. And we talked about system overload. Of course, the other thing through that, when this happens, people become, less patient. So it's, let's get the information quick. Let's get this done. I need to figure this out. So some of the questions aren't always asked that are important or vital. So if you have a piece of information that's important, like the allergy situation, if you're not asked, do you have any allergies? You want to be able to say, my child has an allergy. I have an allergy to this medication. I don't know if that was noted in the chart. So you raise that awareness on some of those red flag, really important subjects that can have consequences if it's not alerted. And then, of course, this pressure to make quick decisions because we've got other people. This is all tied into making sure that you have clear and accurate records and you discuss those with the healthcare professional. Well, then we talk about our policies. So, we have, the white ivory tower scenario, even in healthcare, where we have people who are shifting policies or making policies based on budget, based on insurance requirements. And then we don't always mirror that with when the frontline staff is trying to do things in healthcare, what that looks like and what that means. So sometimes shortcuts are taken or things aren't exactly explained properly. So then errors happen. And then we, of course, have complex and inefficient systems. We got to talk to this person. We got to get that. We can't do this until we have an approval. So you get caught in that. And so that's why it's really important to be clear when talking with healthcare professionals. This is my insurance. I've already called them. They can cover this. Try and get some of those answers ahead of time when possible. Or if not ahead of time and you find out about something, you want to take that information and try and action it yourself so that you get the information rather than waiting for someone to do that for you and delaying treatment. And then we have the culture of silence. When healthcare professionals make errors, we did see in the US that a nurse was charged and was criminally charged with this. So sometimes things are hidden. And because of that, we don't catch future errors, or we don't prevent things and policies put in place to prevent things for future errors. So it's really important that if you notice an error has happened, hospitals, pharmacy managers, physicians' offices, colleges, the professional bodies that govern healthcare professionals, they're all available to you to alert them that an error has happened, because that information actually is vital. And it is helpful when the general public raises these concerns. Very helpful. And then no matter how brilliant, and I always say this, we have brilliant people in healthcare who have studied years and years and years, but we still make mistakes because we're human. So trying to mitigate those is part of our journey in healthcare as the patient. So what are these red zones that I'm talking about? So one really important statistic I want everyone to be aware of is that the errors that happen in healthcare is actually the fourth leading cause of death in North America. So if you think of heart attack and breast cancer and cancers in general, car accidents, this is on a higher than car accidents in North America, because we engage in healthcare, each one of us, at least I would say once a year when we go do a physical, at least when we go get our teeth cleaned at the dentist's office. So we're engaging in healthcare, picking up vitamins, picking up a prescription at least once a year. And this occurs from birth, and we are in a hospital as women giving birth, and our babies are in the hospital. So it is something that can happen. And that is why being vigilant is so important, and understanding the strategies on how to mitigate risks where they can be mitigated is really important. So what are some examples? Well, of course, the wrong medication or the doses given. We see this happen on a daily basis, I would say, in hospitals where sometimes the nurse has measured it incorrectly or the wrong medication was provided. When you go into a pharmacy, you pick up the medication, it looks different, that's the wrong dose. The doctor's office refilled a prescription, but it was the wrong dose. It should have been a corrected dose. It should have been decreased. This is where you really need to understand the treatment plan. What is it that's being prescribed? What dose is it being prescribed at? And when it's provided to you, that you double check that it is correct. I can't stress that enough. And if there's any intolerances to medications, which is different than an allergy. So an allergy is basically an allergic reaction. I can't eat avocado, I get a rash, I could stop breathing. Same thing with a medication. I can't take Tylenol, I'll get an allergic reaction, I get a rash. But an intolerance is when I take that medication, I vomit very badly. When I take that medication, I have really bad diarrhea. That's what we call an intolerance to medication. So you didn't want to have that as a side effect that then allows you to not function. So when you have those things, you also want to make sure that you speak up to that. One of the other things that's really important for children under the age of 18 especially, medications are dosed by weight. So knowing your child's weight, anybody under the age of 18, we should know their weight before medication is dosed. So that's really important as well. And how would you confirm that or double check that? You would just want to make sure that if you're in a hospital situation, that the weight is taken, going to the doctor's office, the weight is taken before any medication is prescribed, so that you understand what the weight is. If you're going to the pharmacy and you're asking for medication, grab the weight of the person under the age of 18 before you go, because likely the pharmacist might ask you, well, how much do you weigh? Because that's how we dose things typically. When I look at medications and when we see the errors that happen, one of the things that's a fantastic invention, of course, is our iPhones or our, Samsungs, whichever brand, but our cell phones are absolutely fantastic in that you can search and Google the name of the medication and you can hit images and see what that would look like. So let's say the medication that you Googled is gabapentin 100 milligram capsule, and you see the color of it. And, most of the images will have the exact same color. Might be a little bit of variances depending on the drug company that makes it, but you'll have an idea of what it should look like. If you get the bottle and it's a pink tablet, you'll know right away that something's not right. And you can easily, and please do easily, speak to the pharmacist and say, this doesn't seem right. I was just looking and I thought it was supposed to be a white capsule. Actually, this is a pink tablet. Is this gabapentin 100 milligram? It just doesn't seem right. I can't tell you how many times this has happened. And in the world of pharmacy, when it does happen, as a pharmacist, if I was on the receiving end of that, most of us would think, oh, well, we're questioning the pharmacist. Well, in fact, what that ends up doing is, as a pharmacist, when someone calls and says, I was supposed to get a pink tablet and I don't know why, but I have a white capsule. Let me tell you that all of us as pharmacists, our heart sinks and thinks, oh gosh, we got to sort this out. It's never, oh my goodness, don't ask me these questions. It's always oh, this is an alert for us. We've got to investigate it, which is part of our, of course, position and job. So same thing applies when you're in a hospital and you're getting a medication from a nurse that's being hung on the bag and it's an IV medication. One quick question: what is the medication that, my son is getting? And if they say, oh, it's ampicillin, you think to yourself, well, the treatment plan said it was supposed to be cephalexin. So then you say, oh, I didn't know that the medication changed. So two questions. What is it that, you're hanging? What is it that now my son is getting? And what is the name of it? Because they'll tell you that. And if it seems off, you just say, oh, I didn't know that was being added. Is that new? Because the doctor had told us that my son was going to get this. This actually happened to me. My mom was getting home IV, and then we had to go into the hospital to see the infectious disease doctor because she had a cut that went bad. And when we got there, the nurse was hanging a bag for a medication that was actually last week's dose. So the whole medication changed. And so, what are the consequences of that? Well, the treatment plan isn't going to go accordingly. So, it's the same thing that you have to consider when you think about this, knowing the names of the medications, when they're supposed to be given, and at what time and what they look like. This is a huge preventative strategy that you can take on with very little effort because you just ask one or two questions. What is it that I'm getting? When you go to the pharmacy, have a look at the medication. Make sure that whatever the physician said to you, I'm going to give your son this medication, you know the name, the dose. So it's, gabapentin 100 milligrams 3 times a day. So you know those things. When you go to the pharmacy, make sure that you speak to the pharmacist and those two things match. And then we look at sort of what are the 5 questions and the pathway for that when you are actually looking at medications in particular. So why is this medication being prescribed? You want to know the answer to that. What is the medication going to do? How is the medication going to work? What needs to be avoided with it, or what needs to happen with it? In other words, do I take it with food? Do I make sure that I don't take it with my calcium multivitamin? What does that look like? And then how and what do you do if the medication isn't working, or if you have a side effect that is becoming unbearable? And like, can I stop the medication right away? What are the reasons why I would stop this medication, and who do I contact for follow-up? So for an antibiotic, if you get a rash, of course, you're not going to keep taking it, but you can't necessarily just stop and go on your way. You need to then follow up and say, I have a rash to this medication. What's the next step? So that's a really important thing to remember too. Just ask your 5 W's. When you are stopping a medication, you want to keep the history of that. The reason being, what we talked about was with the intolerances, so that if someone says, well, we're going to put your son on this medication, you can say, no, I remember that medication. That is not going to work for them because it caused hallucinations. It caused really bad shakiness, whatever that caused. So you know why it was stopped, and you record the name of the medication and the date that it was taken and why it was stopped. So that history is really important to prevent any further errors, because sometimes it might not be the same name of the drug, but it might be in the same class of drug. So if we think about what does that mean? Well, vegetables is kind of like the class. It might not be, a carrot again, but it might be a red pepper, but that's within the same class called vegetables. So we look at medications the same way. So you really want to make sure that you have that. And then any current medications that are being taken, this is a really important thing. The current doses. So, my son is taking Tylenol 500 milligrams 4 times a day on a regular basis. They're taking calcium 500 milligrams every day at lunch, so that you have it recorded, really important, so that if somebody's adding a medication, they know. Don't just assume that that information is going across healthcare systems, because it might not. You need to be the person with that information. When someone says any other medications being taken, you have that list handy for yourself. And be honest about how medications are consumed. There was a situation where one of the patients kept coming back into emerge, and we were evaluating the morphine dose, and we were wondering why we couldn't get the pain under control for this particular patient. When we asked the caregiver, how are you giving the medication? We came to find out that they were measuring a tablespoon as a teaspoon. So it was 10 mils less of the actual medication. So it's really important, if you're not taking the medication 3 times a day and only twice a day or once a day, that you explain that. Be truthful, or not taking it at all. Just be truthful. I wouldn't feel that doing that in a good relationship with a healthcare professional would make you feel that you're going to get in trouble. I think it's really important that you have that open communication, so that your care can be better tailored. So in other words, if a medication is causing you a bad headache and you're not taking it 3 times a day, but you find taking it once a day, it's tolerable and you feel better, you want to express that. You want to make sure that you explain that. And as well, same thing. When I talk about you, I'm talking about for your child, for your family. I really want to make sure that you understand that being truthful and honest with a healthcare professional, it should be a good working relationship. You're the center of it. Being an active participant and being the center of healthcare ends up meaning your rate of error goes down by 50% by being an active participant. And don't forget, natural products, we call things natural. There are many natural products that are deadly. We can think of lots of poisonous plants. And so we have this notion that if it's away from Western medicine, that it's going to be safe. And unfortunately, chemicals exist, whether it's made from a plant or whether it's considered herbal or whether it's considered prescription. It's still something you need to make sure will work with the disease or will work with the actual other medications, because interactions can still happen, side effects can still happen. It's still a chemical going in your body, okay? Emergency. So many of us will at some point, hopefully not, but at some point we will be caregivers or we ourselves will go to emergency. So when we look at triage, the nurse, when you first come in, the nurse is assessing what level of emergency it is. And so you want to be very clear at this point, or your advocate who's with you, or if you are the advocate, you want to be very clear on the signs and symptoms of what's occurred. And it might be when you get there that the nurse says, okay, they have decided they've done the vitals, they checked blood pressure, they checked whatever they need to, and they're finding, okay, well, this is okay. We're going to put it as sort of a lower level of risk. That could end up meaning waiting for an hour, 2 hours, 3 hours. It could be a long wait because other more urgent people are coming. Not all nurses, remember what I was talking about with time constraints, not all triage nurses remember necessarily that you're in the waiting room. So if things progress and get worse, you do need to go back up to the triage nurse and say, things are getting worse. The pain is higher. My son is not able to cope right now. His mental state is getting worse. I don't know if I can keep waiting. You have to actually advocate at that point as well. There was a 12-year-old boy who had appendicitis, which of course at the time just looked like he had a stomach ache. He ended up dying waiting in the waiting room because he was getting worse. And the mom just said, well, they're going to call us when we go in, not feeling that they had a right to advocate and go back to the triage nurse because they were told to sit and wait, that they could go back. So I really want to tell you that this is a really big red zone. It has happened to many people where they're waiting in triage and they get worse. So I really want to make sure that you're aware of this. When I talk about the detailed notes, this is what I mean. It's something called SBAR, and it means situation, background, assessment, and recommendation. So how does this look like on a daily basis if you are trying to speak to a physician or the dentist, or you're going to emerge? So what is the situation? So this is how we as healthcare professionals assess these things. So if you're coming with the answers to this, imagine the communication and how easier it's going to be between us as healthcare professionals and you. So what's going on right now? This is what we're going to be asking. We're asking that question. Come prepared with the answer. And don't think something isn't important. So write down all of those signs and symptoms. My son vomited at 3 a.m. and it was green, or whatever that color looked like. Try and be as detailed as possible. The more information, the better. We know that about most things. This really applies to this as well. And then any relevant medical history. So this is where you would talk about allergies or what your child's diagnosis was, some of the things that you need to avoid. If you have a situation where one of your children has an addiction issue, you want to make sure that you're clear and honest with that, because then certain medications need to be decided which ones you should be taking and which ones you shouldn't. So that's also very important to make sure that you provide that information at that point. And what do you think is happening? So you're not healthcare professionals. You're not going to answer this by saying, I think my child has appendicitis, because that's not going to be an answer that you can provide. But what you think is happening is you can say, well, they're in a lot of pain. I think, something's occurred. They were outside, they played. He said that he heard a crack. I think maybe his leg is broken. So whatever you can think of in that situation, you don't want to pigeon nose and only think about one thing only. Keep the sort of range of possibilities open, but explain what you feel has happened and what you think is going on. And I can tell you that a lot of times, moms in particular, it's a sixth sense. I know that dads probably have it too if they have witnessed what has happened. You get a sense of, I think this is what's going on. Don't be afraid to express that. And then, what are you requesting or worried about? So explain. I'm worried because they don't normally have a stomach ache when they have a high fever, or, they're complaining that they're not feeling well and that they're feeling suicidal at this point. That's not something we normally hear. And we just started a new medication. So new medications, antidepressants, can, as a side effect, have increased suicidal thoughts. So it is something where you want to make sure that you paint that picture as clearly as you can. So here's a situation just as an example. So this is your situation. Hi, I'm calling about my 4-year-old daughter who vomited this morning. She has a low-grade fever yesterday, but no symptoms, no past illnesses. She's thrown up 3 times. She seems pale. She isn't keeping fluids. I'd like to know if I have to come in today. So what's your ask? I want to know, should, we be doing something different with the medication? What do I do? Does something need to be stopped? How do I help them right now in this crisis? Okay. And then when we look at transition and handoffs, I express this, and I think this is another really critical red zone. So going from hospital to community, have a list of all the medications, what's start, what's stopped, what's been added, who do you see, where are your follow-up appointments, where are you seeking treatment, where are you seeking resources, so which communities are available to you, what insurance information do you require when you get the bill from the insurance company, ensuring that it's an itemized bill so you can review it, so that you have all your information when you're transitioning, because this is where details get lost that are critical. You might not have a follow-up appointment scheduled. You want to make sure, do I make that follow-up appointment, or are you? When will I know by? So that when that date passes, you're not sitting and waiting and nobody's made the appointment, and it's critical for you. So really ask what the treatment plan is, who to seek information from. And the other one is, if you are in emerge or you're being discharged, why would I come back? So we're going to follow this treatment plan. What are the red flags for me to know to come back before I see the specialist or before I see my family doctor? Would there be a reason why I would come back? So you want to know that part of your treatment plan. And then this is another area I see very often. So typically what we'll hear from physician offices is, we'll call you if there's a problem with your labs. Fortunately, nowadays, there are applications where we can go in and look at the lab results and see if something's normal or abnormal. I think it's a really good idea to access those and to follow up on your lab results or x-rays or ultrasound, keeping those scheduled if it has to happen once a year, because it's a really good idea to track these. Sometimes things get missed. The lab doesn't actually process it. It doesn't get sent to the physician, or it gets sent to the wrong fax number or the wrong physician office, and it doesn't get followed up. And then you think there's nothing wrong, but in fact, those results were never properly reviewed. So you really want to make sure that you follow up on your labs or any other tests that were given to you so that you know the answers. And one of the tricks that I've learned is, when you have a lab that you now have done and you go to the lab or you go to the test and they say, oh, your doctor are going to get the results in a week. what I've done is I book the appointment for 10 days after that. So if it's ready in a week, I'll call the office and I'll book an appointment and I'll ask, so what happened with my labs? So that they say, oh, it's normal, or no, it's not. And so that I don't have to sit and wait either for a phone call. I will get that result myself directly from the physician's office. And if it's in a hospital, you want to ask the nurse that comes in what happened with the test results of that ultrasound, so that you know this was done. You need an answer to that result. And then when we look at, in particularly, red zones for mental health or addiction challenges, unfortunately, there is still, sometimes there can be biases or stigma surrounding patients with mental health and addiction challenges. And I have seen this in my career, and it is a situation where sometimes, it's not fitting the norm. So what are we doing in these situations when someone is upset, yelling, screaming, um, not being able to be settled? The nurses have 20 other patients. They want to settle this patient. They're going to give them a medication to settle them. This may or may not be in the best interest of the patient. So if you are an advocate, you want to make sure that you're very clear with your past experiences, because there is something to be said that when somebody has a bad experience, sometimes there is really this deflation of not wanting to communicate, not wanting to engage, because you just basically become like a round ball and you don't want to actually even have a conversation because you feel that tension from before. What I want you to do is, as a caregiver, I myself get very emotional. I'm a very anxious person. I always try and calm myself down, and the disassociation that happens is real. But you want to make sure that you have things written down so that you remove part of the emotion out of it and you stick to the facts as much as possible. My child at this time said this, wasn't feeling well. This is really what we're here for. This is what we need. The medication caused this. We missed a dose. This is the result of it. Try and stick to your sheet of paper, and as much as possible, taking away that past trauma experience of having to go through this if it's occurred to you, so that you have a strategy to cope. And I feel that the anxiousness, of course, when it's one of our children, we're there. We're anxious. We're asking for help, and sometimes we don't get it. The system is ignoring us. It's just running wild, but we need the help. Make sure that you have things written down. And one of the things that I always say that you want to be clear is, I need help and I need help with this, so that you are very clear with what your ask is. Because if you just say, I don't know what's going on, it's too vague in the sense that there's so much else that's in someone's mind. You need to be specific. I need help with my child who is experiencing withdrawal right now. I need help with my child who I feel may have overdosed on something right now. And so even if you're wrong, even if you're not 100% correct, by getting action, that's being clear. You need to be clear to get the action, and don't be afraid to speak up. And if that's difficult, write it down so that you're reading it off of a sheet of paper. That'll help to keep things in line, in the sense of, now you feel like I'm just reading. Just, change that in your brain from being anxious to just being, I'm reading. This is a script. I've got to read this. I've got to get this accomplished. Write it down and read it. I've seen that many times help a lot of people when they feel completely overwhelmed with the situation. All right, so here are some of the strategies. Maintaining a personal log book with appointments, medications, treatment plans, really important to keep things noted. If you're in the hospital, sometimes our hospitals don't use great Wi-Fi. You can't get access on your cell phone. Bring a notebook, tiny little notebook, fits in your purse or your pocket, and a pen or a pencil, so that you can write things down, so that you can track things, because there's going to be a lot of information when you go to a doctor's office, when you go to a treatment center. There's lots that's going on. So you want to make sure that you have this available to you so you can write it down and refer to it. try and make sure that you remember the ACE principle. And I call the ACE principle advocate, communicate, and educate. Try and make sure that when you get the treatment plan, you do a quick, you know, research, do a quick looking. Physician suggests that I should increase the dose to 20 milligrams. Based on this age, what is the recommended normal dose? And then if it's higher, you want to say, now we're going to give, 3 times as much. Is that considered normal in this situation? And it may very well be if we're treating a crisis. So you just want to make sure that you do a little bit of quick research right in that moment as well, so that you understand which questions to ask. And the best way to say this, because a lot of people think, well, I don't want to tell the doctor that I Googled things. Well, the best way to say this is, well, I was just referencing what you had said, and I just wanted to understand because what I have read is this. And then you just have that open and honest communication with the physician. I'm uncomfortable with that kind of a dose because I saw that the recommended usual dose is this. Is that correct? Or have I misread that in this situation? Is the higher dose appropriate? Whatever that looks like. It's also something to then flag the healthcare professional that potentially the dose is too high. If you are wanting a differential diagnosis, the physician is saying something or healthcare professional is saying, oh, this medication's for this is going to work out, and you feel that that doesn't sound right, it wasn't what was explained to you, it's just something isn't sitting properly, just make sure that you ask for clarification. Healthcare is a different language. I always say that. And I think about when the first year that I went into pharmacy, I started at a drugstore and I did not know what Delsum was. I didn't know that was a cough medicine. Compared to after 5 years of education, I was speaking in terms of medical language. I forgot my normal day-to-day practice. BID was what I would say is twice a day instead of saying twice a day. So you sometimes have healthcare professionals speak in their language and it doesn't make sense. So if that's true for you, then just ask. Say, I'm sorry, I have to just ask you to repeat that. I don't understand. There's nothing wrong with that. You're best to know exactly what the instructions and the treatment plan are. That is one of your biggest defenses to making sure there's no errors. Okay, if there's a situation where we talk about mental health and or any substance abuse screening, you want to make sure that you're clear on anything that has to do with risk versus benefit. Sometimes we jump to, we want to do this test, we want to do this, we want to make sure this psychologist is involved or this, and we forget who our patient is. So, your daughter, your son, your spouse, you know them best. Have a conversation and just say, look, this is what's going to happen. This is what's being suggested. How do you feel about it? Because sometimes we don't ask that question and it's wrong. It should be patient-centered. We should be knowing how the patient feels, even if it's a 10-year-old boy. Look, we're going to do these things. I know it's not going to be, getting a needle for a blood work isn't going to be the best, but we need to make sure that your tummy, that whatever problem you're having with your tummy gets resolved. So involve your children in some of this decision making, or at the very least, involve them in understanding the plan so that they don't feel sort of, like it's all happening to them, that they understand it as well. And then, of course, unfortunately, if it comes to the point where you don't feel seen and heard, and you have tried some of these strategies, you've tried to communicate, you've tried to assert your opinions, and it's falling on deaf ears or it's not being listened to and you're still feeling unheard, you may at that point definitely want to start seeking a second opinion. And there is nothing, absolutely nothing wrong with doing that. If you don't feel that the communication is appropriate, this is your child, your healthcare, it is vital that you have a good working relationship with all your healthcare providers. It's really important. And I know that some insurance companies mandate that you are within a certain, hospital, or mandate that you're within a certain managed care group. I would speak to the insurance company and ask how you can navigate through that as well so that you still get the care that you require. So, one of the other things as a caregiver, if you are providing medication, I wanted to just quickly go through this because when you're providing medication, it's really important that you know how to do that as a caregiver. You have to understand the 7 rights of medication. And by learning this, you also understand when a nurse or anyone else administering care aide is administering medication to someone, that they're also following this. So you want to make sure that the nurse, yourself, you've got the right person, the right medication, the right dose, the right time, the right route. And route is really important because sometimes medications have to go under the tongue to work. They don't get swallowed. They can't get crushed. They can't be chewed. So it's really important that you understand that even when you're giving medication. It might be a large tablet and you think, oh, I'll just crush it and it's going to be easier. No, sometimes these slow release medications cannot be crushed. And if they do, they can actually cause issues with the heart or issues with how much is given at one point in the body, the way that it's actually taken into the bloodstream. It could be too high of a dose at that point. And when it's a slow release tablet, the issue is that it comes out into your body in slower segments and it's being absorbed into the blood slowly versus one big dose of 500 milligrams, let's say. So that's why you have to make sure that you understand how the medication is going to be provided. And then documentation. So if you give a medication, it's you and your spouse that are managing this or your partner, then you're writing down, okay, I gave this medication at 11 a.m. Well, if you don't mark that down or have like a table on the fridge or in a book, and you don't have that marked, somebody might come through and say, oh, you know what, I'm going to give my child this medication. But you can't because it was already given. So then you can potentially have an overdose. This can happen in the hospital as well. So that's why you want to make sure when medications are provided that they're given at the appropriate time. And we talked about measuring. Really important, you don't use a kitchen teaspoon, a spoon, but you use the appropriate teaspoon, tablespoon, the measuring cup, whatever that is. Try and make sure that you stick to that appropriately. And I will also suggest that if you're taking medications and your child has medications, that you separate them. We had a hospital admission where one of the mothers had a high blood pressure medication next to the child's ADHD medication. The 12-year-old boy just went to the bottle, took it, swallowed it, went to school, wasn't feeling well. And then the mom realized, oh my goodness, when she went to take hers, because the son hadn't closed the cap properly, that the son actually took her high blood pressure medication. So then she ran to the school, got the son to emerge, and then it was managed. But really important to separate medications, keep them up and high and away. And if you have any issues with addictions or with mental health, you want to make sure that you control those medications because it's quite easy to take 5 or 6 if they're just there or if they're in medicine cabinets and they're available. These medications should be locked. It's really important that you manage and control that. And then the last thing is, of course, side effects and adverse events. So there has been situations where people have come into the drugstore and said, oh, my son has a rash all over the body. And I say, oh, are they on any other medications? We don't think about medications as the #1 issue that can cause a side effect. We often think, oh, well, I'm so nauseated. I don't know why. It must have been something I ate. 9 out of 10 times, if it's a new medication, it's connected to the medication. So you want to make sure that even in the hospital, if it's a new drug that started, you want to understand what the side effects are. Sometimes 2 medications put together, like if you talk about the class of drugs, it happens where we use 2 medications in the same class. So we'll use the carrot and the bell pepper, but in combining those, the side effects could intensify. So the dry mouth, the blurred vision, the nausea, the vomiting, it could get worse. So this is why you want to make sure that you understand those side effects, how to reduce them, because sometimes it's just, is this something that's going to go away in a week? If I just eat food with it, if I take it before bed, could that work? What are those strategies to help to reduce those as well? You want to know those. And then we talked about this, except I didn't mention, which is really important, if it's a frigid item, There are ways to lock up the medications that are liquid in the fridge if it's required in that sense, if it is a medication that has to do with addictions. What I would suggest, though, all medications up high. So had a baby that decided that amoxil was quite yummy, and even though things are childproof, I do not know, but I think it's harder for adults to get into the childproof medication than children, because they sometimes can do it better and navigate that and open it more than we can. And the child drank the whole bottle of amoxil. So it was in the fridge, and like the banana flavor, drank the whole thing. So it's really important that we keep medications, if they're supposed to be in the fridge, up high. And then we talk about the side effects, and sometimes we don't think about these things. And one of the things that I've seen often is medications that can interfere with your sun protection. You know, you get a really bad rash, and I just always just use a little bit of sunscreen and I'm good. But medications sometimes can decrease our ability to protect our skin when it's in the sun. So you want to make sure that you know that. Do you shake the bottle? Do you just, not shake it? Does it have to be refrigerated? Is there an expiry date to it that I need to be aware of? Eye drops, once they're open, the expiry date on the bottle says it's good for 2 years, but all eye drops, once they're open, typically are a 28-day expiry. So you want to make sure you understand that. And then I did, when I was researching quite a bit of things, when I did my TEDx talk, I spoke to one of the moms where her 8-year-old boy passed because of a medication error. And it was a compounded medication that she got for her son, which was tryptophan. But when her son passed, the next morning when she went to wake him up and found that he had passed, it was because of a medication error. The pharmacy had compounded the wrong drug. So when I suggest that if you are getting a liquid, you taste it. You make sure that if it's a refill prescription, you taste it again. You just want to make sure that it's consistent, it looks the same, the color's the same, it tastes the same before you provide it again, because compounded medications have a high rate of error. But it can be mitigated if you understand. If it's the first time you get the medication, you want to ask, what should the consistency look like? What should it taste like? Because there is certain tastes for certain compounded medications versus others, and you want to know what that is so that you can help to mitigate that risk. So overall, we look at recognizing signs of illness. So this is where we track these things. We have to document them. What medications have been given? What does the progression of the symptoms look like? My son had a headache, but now he has a headache and a fever and a tummy ache. What does that all look like? And then one of the hardest things to do is to figure out, well, is this an emergency or can I manage this at home? If you are really unsure and you are concerned, I always say go to Emerge. And when you go to emergency, bring yourself a pack, like get a backpack, put some snacks in it, bring a book, bring a pillow. So oftentimes you're sitting for a long time. Bring a blanket, bring something like a bag, a Ziploc bag, in case there has to be any vomiting. Bring an extra set of clothes. And you're going to laugh at me and say, if it's an emergency, I don't have time for all of this. And I understand that. So as a pharmacist, I know this is going to sound crazy, but I have an emergency backpack and I keep that there for an emergency. And sometimes when you're in that, I don't know if this is an emergency or not, and I'm just going to watch it, prepare the backpack. That's the time to do that. Because if you do then have to go to emergency and it's something where you're not calling an ambulance, you at least have some preparedness. Put that notebook and that pen and pencil in there as well. And some water. Hydration is really important when you're looking at managing illness. Hydration, rest, and the pain reliever or some of the medications. And of course, when we're looking at addictions, we really have to be focused on watching our Benadryls, Gravel, and looking. So the Benadryl is dimenhydrinate. And then you're looking at, ibuprofen or acetaminophen as other alternatives to pain relievers. And you want to know what kind of pain relievers and what kind of medications you can use if there is some addiction issues that you're trying to mitigate or to manage. And then age appropriate explanations and reassurance. So if you have a child who is 5 years old versus someone who's 10 versus 15 or 20, how you're speaking to them is going to be age appropriate. But what you always want to say, because emergency and those situations are scary, is we're going to just go get it checked out. It's better than you staying at home. Let's go get it checked out. And for a young child, it's the same thing. We need to go ask the doctors because mommy doesn't know what's happening. We need to go get some help to find out so you can feel better. And then preventative care. So what's really important is sometimes we get so busy that we don't schedule things like a weekly checkup that we had to do, or a yearly or a monthly lab test that we had to do, and things get in the way. These things are really important. I have had situations where medication named warfarin was supposed to have a blood work done every week, and they waited 4 weeks, fell in the shower, hit their head, and bled and died. That was one of our patients. So it's really important when the treatment plan is prescribed to you or provided to you that you follow those things. Schedule it in. It's just an appointment in the sense of like, okay, I have to take work off and I have to do this. It is important. And if you feel that you can't get to it and you just aren't able, then you want to raise that concern to the person that prescribe that treatment plan for you so that you can say, this is really difficult for me to do once a week. Is there any other alternative to it? And so you understand the risk versus benefit of missing that appointment. What I also do for my children and for myself and for my household is everybody's birthday gets the day at the doctor's office. It's a treat, right? Yeah, I'm being ironic, sarcastic. But here's the thing. Every birthday then, I know that's the day for everyone to go do their annual checkups because it reminds me of what has to happen, and I book it ahead of time, and that's the day that I make sure for everyone in my family I don't work that day. So it's every morning I try and schedule those on their birthdays so that it's like we're going to go out, we're going to go to the doctor's office, we're going to the dentist, we're having a day of it, and it's done once a year. So obviously birthday might not be the thing that you want to pick, but just schedule once a year for those things and maintain that and try and keep up with it. The other thing I'm going to say is vaccinations. I know it's a hot topic. There are some vaccines that are scheduled that are really important. They come in series of 3. If you miss that appointment, you might have to repeat the whole series again. So it's really important to keep track of those dates. And of course, there's tracking milestones that you can use. There are many different applications. There's many different journals that you can get. And I often really like the idea of even a family health binder where you can keep your records, things that come back from the dentist or the doctor's office or the veterinarian. Even if we're thinking about pets, all of this applies. Trying to keep track of things in one central station in the sense is a really good idea, especially if you're the primary caregiver and you're away at a town, at work, someone can't get a hold of you, then the next person who is caregiving, whether it's a grandparent, a babysitter, the other parent, they can as well step in because the information is sitting in one location. So that is what I wanted to let you guys know. One of the biggest things that I want to leave you with in the sense of why this is so critically important is advocating in healthcare situations is your number one defense. Asking some questions is not becoming assertive and being someone who's a problem. Aggressive behavior becomes that. When you're dealing with anyone and you're aggressive, the other person typically will shut down or fight back. And then you're losing the battle. You're not then actively participating in your care. So I would often say that if you ask the questions, that's absolutely nothing wrong with. You need to ask those questions to protect yourself. Do it in a manner where you are assertive, where you ask for the question and expect and wait and ask again if you don't get an answer. but don't become aggressive, because aggressive behavior shuts down the person who's advocating, sometimes removes them from the situation. And that's absolutely not what you want to do in these situations, because then you've lost the battle. And there is, you'll see this almost everywhere. Verbal abusive behavior will not be tolerated, because when a loved one is sick, is hurting, you yourself don't feel well, it's only natural that we would, in those situations, become more aggressive because we want the care. But take a deep breath, write it down. What is your question? Sometimes handing the sheet of paper over will work as well, so that you don't and you aren't so emotional that you can't get your message across, and or it comes across as being aggressive, and that's not your intent. So I have been on both sides of that. I have been actually an aggressive patient, and I've had to learn to step that back. So I write it down and I calm myself down so that I get the answers that I need. And always bringing an extra pair of eyes and ears for support, if you can, is very critical in how you are able to advocate, because the other person can take the notes, can help to write down things, can help calm down the situation, can help be supportive. It's something that if you think, oh no, I've got this, I can do this by myself, please think it through. If somebody else is willing to come and help, ask for their help. All right. One of the other things that I just wanted to let everyone know is that there is definitely abilities for continuing your education in things. There are courses on understanding how medications work, and I'm not making you all mini pharmacy assistants. I'm just saying that if there is a situation where you are, you know, knee high in this, try and get more information, look for these resources, go to associations, support networks. There's mom networks, there's, many different addiction and specialist networks that you can get some support, some of these tools. It's really helpful for you to be part of these communities, and something exactly like this. The National Federation of Families is a great resource to try and speak with and have some of these challenges that other parents have, how they coped, what their strategies are. It's a really good community support system, so you don't feel alone in it. So recap, one of the things is assess the risk versus benefit. Really important to do that in every healthcare situation. Whether it's a medication, a surgery, a treatment plan, something with whether I need to take this CAT scan or not, look at the risk versus benefit of the treatment plan and ask, if I don't do this, what would be the consequences? So that's how you can address it. So you understand what level, because for someone like myself, if I had to take a medication that thins my blood, that would be a huge risk to me. I could easily die from a bleed. But if I had, clogged arteries and my heart had atrial fibrillation, but that's the huge benefit for me, so that I don't have a heart attack or I don't end up with an irregular heartbeat that causes my heart to stop. So risk versus benefit is different for different people. You have to assess it for the particular person. Okay, any questions or comments, please let me know.